we are going to be examining how a volume osmolality diagram would be altered in 5 dental cases. Our first dental patient presents to us with a post-extraction hemorrhage, meaning that there is excessive blood loss. The patient has a condition called hemophilia, in which the blood is unable to properly clot following an injury. Our first step is to determine how this situation would affect the extracellular fluid volume. In this case, the patient has lost a volume of blood, which is a component of the extracellular fluid. So our extracellular fluid volume would decrease. Now it gets a little bit trickier when we imagine what would happen to the extracellular osmolality. As the patient lost blood, it wasn't just fluid leaving the body. There were also a number of solutes, such as sodium, chloride, or glucose. In fact, the fluid lost from the body is approximately isotonic, so there will not be a large-scale change in the extracellular osmolality. In order to visualize this process, I imagine a pitcher of red drink, with the saturation of the color indicating the concentration or osmolality of the drink. I can then pour out a glass of drink from this pitcher to simulate the blood loss that occurred during the hemorrhage. You'll notice that the concentration of the fluid lost is identical to that of the original fluid. Furthermore, notice that the fluid left behind in the pitcher has remained the same color, indicating that we were still in an isotonic state. So if we return to our volume osmolality case, we can see that the cells of the body are in an isotonic solution, so they will not experience a change in intracellular volume or osmolality. If we place this information into our diagram, it would appear something like this. Notice that the extracellular volume has decreased, but there is no change in extracellular osmolality. Thus, there was no change in the volume or osmolality state of the intracellular compartment. Now, some very astute students have pointed out an important issue with this particular case. When there is blood loss, as during hemorrhage, there is some loss of cells, such as red blood cells and white blood cells. However, the number of cells lost would be minimal when compared to the trillions of cells in the human body. Thus, we would not expect to see any significant changes in this scenario to the intracellular compartment. Let's now examine patient 2, an orthodontics patient who ate a very salty meal for lunch. In this case, the patient has added lots of solutes, sodium and chloride, into the GI tract. If we first examine the extracellular fluid volume, there is no mention of water consumption, so we must assume that this value has not changed. However, we do know that the patient has ingested lots of solutes, so the extracellular osmolality would increase. The cells of the body have now been placed in a hypertonic solution. As you will recall from our basic diagram, this hypertonic saline solution would cause the cells to shrink, moving fluid via osmosis from the intracellular compartment to the extracellular compartment. So in this case, our intracellular volume would go down, and we must revisit our extracellular volume, which we now know would increase. The intracellular osmolality would also increase due to the loss of water. So in this case, we would see a volume osmolality diagram that looks like this. You'll notice that the osmolality of both compartments has increased due to the addition of the solutes, and the water has moved via osmosis from the intracellular compartment to the extracellular compartment. You were treating patient 3 in the oral surgery clinic, and due to a miscommunication, accidentally overinfused the patient with normal saline. The information is provided for us that this IV solution is approximately isotonic at 286 milliosmoles per liter. The name normal saline is derived from the fact that the saline solution has an osmolality relatively normal to a patient's blood. Since we have added excess fluid to the patient's blood, the extracellular fluid volume would increase. However, since this fluid is relatively isotonic to the blood, there is no change in the extracellular osmolality. In order to picture this, I revisit our previous analogy with the red drink. Let's imagine that the pitcher of fluid is our patient's existing blood, and the glass of fluid is our IV solution of normal saline. You'll notice that the color saturation of the two fluids is the same, indicating that they are the same osmolality. If we add the IV solution into the pitcher, representing the patient's blood, you'll notice that the volume increases, but the concentration does not change. So, if we revisit our scenario, the extracellular volume has increased, but the osmolality has remained the same. Thus, the cells of the body are in an isotonic solution. Consequently, there will be no net flux of water, and the intracellular compartment will remain unchanged. So we should see a volume osmolality diagram that looks like this. The extracellular volume has increased, but there are no other changes in the patient's status. Patient 4 was provided with a hypertonic salt solution to use as a rinse after an oral surgical procedure. However, the patient misunderstood and drank the highly concentrated saline solution. In this case, the patient has added highly concentrated solutes, sodium and chloride, into the GI tract. If we examine the extracellular fluid volume, the patient has ingested the saline solution, so the extracellular volume would be increased. Additionally, this fluid was very concentrated, so the extracellular osmolality would also be increased. The cells of the body have now been placed in a hypertonic solution. As you will recall from our basic diagram, this hypertonic saline solution would cause the cells to shrink, moving fluid via osmosis from the intracellular compartment to the extracellular compartment. So in this case, our intracellular volume would go down, and the extracellular volume would experience an even larger increase than we originally reasoned. The intracellular osmolality would also increase due to the loss of water from the intracellular compartment. Thus, we would see a volume osmolality diagram that looks like this. You'll notice that the osmolality of both compartments has increased due to the addition of the solutes, and the water has moved via osmosis from the intracellular compartment to the extracellular compartment. If you recall the information from patient 2 who ingested highly salty food prior to a dental visit, you'll notice that these two diagrams look very similar. Patient 5 suffers from xerostomia, commonly referred to as a dry mouth. Due to this irritating sensation, the patient has been ingesting excessive amounts of tap water. Tap water would be considered a very hypotonic solution as it contains very few solutes. Since the patient has been ingesting this large volume of fluid, the extracellular volume would be increased. Since the tap water is hypotonic, the osmolality of the extracellular fluid would be drastically reduced. The cells of the body are thus in a hypotonic solution in which the concentration of the extracellular fluid is much less than that of the inside of the cells. Consequently, water will move via osmosis from the extracellular fluid compartment towards the higher concentration of solutes inside the cells. Thus, the intracellular volume will be increased and the intracellular osmolality will be decreased. If we draw this on our volume osmolality diagram, it should appear like this. The volumes of both compartments have increased, and the osmolalities of both compartments have been decreased. Thank you for helping to solve these 5 dental cases using a volume osmolality diagram.